Hi, I'm AI Dr. Darren Smith. If you've been exploring non-surgical ways to restore volume, improve contours, or soften signs of aging without looking overdone, this is for you. We're going to walk through one of the most exciting regenerative treatments available today, AlloClae, and how it compares to other commonly used fillers like Sculptra, Renuva, and Radiesse. I'll also explain why it's not just the product, but how and where it's used that makes the biggest difference. Let's start with the basics. When patients come in looking for volume restoration, whether it's for the face, hands, breasts, or body, the most common concern I hear is, I want to look like myself, just fresher. I don't want to look puffy, fake, or obviously done. That's a perfectly reasonable goal, and to get there, we need to move beyond traditional filler thinking. Enter regenerative aesthetics. This is a new category of treatment, one that doesn't just fill space temporarily, but actually works with your body to rebuild and restore. That's what AlloClae was designed to do. So what is AlloClae? It's a next generation regenerative filler made from real purified donor fat. It gives you immediate volume and support like a traditional filler, but it also encourages your body to regenerate from the inside out. That includes new collagen, new fat cells, and even new blood vessels. So instead of just masking volume loss, we're stimulating your body to truly rebuild itself over time. Let's talk about how this compares to some of the other options out there. First, Sculptra. Sculptra is a synthetic filler made from poly-L-lactic acid. It works by stimulating collagen, but it doesn't give you volume right away. You need multiple sessions over a few months before seeing results. And while it can work well when placed correctly, it comes with risks like nodule formation or unevenness if not handled with precision. AlloClae, in contrast, gives you immediate structure and regenerates over time. It's biological, so it integrates smoothly with your tissue. And when placed with care, it offers a softer, more natural feel with longer-lasting outcomes. Next, Renuva. Like AlloClae, Renuva is derived from donor fat, but it's processed very differently. Renuva comes as a liquid, and it's really just a signal to your body to try to grow its own fat in that area. You usually need several sessions before you see a change, and the results are more subtle and gradual. AlloClae has more structure. It behaves like a scaffold. It gives you volume now while also telling your body to regenerate around it. So it's ideal when you're dealing with a real volume deficit, like after weight loss or to correct liposuction irregularities. It's more predictable, more efficient, and often more satisfying for patients who want visible change from day one. Now let's compare it to Radiesse. Radiesse is a calcium-based filler. It's great for firmness and support, especially in areas like the hands or jawline, but again, it's synthetic. It doesn't integrate. It doesn't regenerate. Over time, your body breaks it down, and the firmness can sometimes feel unnatural in areas where the skin is thin or mobile. AlloClae, by contrast, has a natural softness to it because it's made from fat and rich in extracellular matrix proteins. It blends in beautifully with your tissue, and it's safe to use in many more areas of the body, including places Radiesse wouldn't be appropriate, like the breasts, buttocks, or under eye region. So by now, you might be wondering, if AlloClae is so versatile, why isn't everyone offering it? The truth is they are. You may see AlloClae pop up at med spas, but what's often not obvious to patients is that the setting, the expertise, and the delivery make all the difference. At a med spa, AlloClae is often treated like just another filler. It might be injected in a quick appointment with little anatomical planning and by someone without a deep background in fat biology or surgical aesthetics. And while that might be okay for certain basic areas, it's a completely different level of treatment when used properly. At our practice, your care is physician-led from beginning to end. I'm a board-certified plastic surgeon, and before opening this practice, I spent 3 years in a translational tissue engineering lab studying fat biology and regenerative medicine. My background includes extensive research into how fat behaves, how it regenerates, and how to harness its healing potential through advanced grafting and integration techniques. That experience informs every AlloClae treatment I offer. It also means I can confidently combine AlloClae with your own fat when appropriate, or use it to optimize results in more complex cases like breast implant revisions or post-lipo correction. We also use Vectra 3D imaging in our planning process. This lets you preview how different volumes or contours might look on your body before we start treatment. It helps us align expectations, avoid surprises, and refine your plan together. So here's the bottom line. If you're looking for something that looks and feels natural, if you want results that are visible right away but continue to improve with time, if you're ready to invest in a result that's regenerative, elegant, and long-lasting, then AlloClae, delivered in the right hands, could be the most powerful aesthetic decision you make. Thanks for watching. If you're curious to learn more, we invite you to book a private consultation. We'll talk through your goals, explore your options, and create a plan that's safe, beautiful, and truly tailored to you.